Welcome to this video about less common mental health needs. What are some of the less common mental health needs? Firstly, within the category of social, emotional and mental health, SEMH, the most common disorders that are diagnosed by a health professional are anxiety and other mood disorders, such as low mood and depression, and attention deficit hyperactivity disorder, ADHD. Although a formal diagnosis is less usual, the most common types of emotional issues include problems stemming from past and current life experiences with other people, such as attachment, trauma, grief, and loss. These may be expressed in the form of behaviours that challenge, risk-taking, for example, substance misuse, self-harming, and suicidal ideation. Some of the less common mental health disorders include post-traumatic stress disorder, PTSD, obsessive compulsive disorder, OCD, body dysmorphic disorder, eating disorders, bipolar disorder, and psychosis. PTSD. PTSD can happen after a person experiences something extremely frightening and distressing, for example, a violent assault, a serious accident, or a serious health issue. Complex PTSD comes from long-term trauma, such as ongoing abuse or neglect. People with PTSD will typically experience flashbacks and nightmares. They will feel highly anxious, tense, and on edge with the sense that something bad is going to happen again. These symptoms, which affect normal functioning, can be experienced very soon after a distressing event, or there may be a delay in response, for example for days, months, or even years. It is possible that a pupil has PTSD if, for example, they have experienced significant harm which occurs within the context of power and trust. For example, physical, sexual, verbal, and emotional abuse, neglect, and exploitation. If they are traumatically bereaved, causing them to be stuck in their grief and with significant ongoing distress. Or if they are a refugee or asylum seeker, particularly if they've been exposed to traumatic events, dangerous transits, victimization, and broken family bonds. Obsessive compulsive disorder, OCD. OCD has two main parts, obsessions and compulsions. Obsessions are unwelcome thoughts, images, urges, worries, or doubts that repeatedly appear in the mind. Compulsions are repetitive activities that one does to reduce the anxiety caused by the obsession. OCD takes many different forms and can range from mild to severe. Children and young people with OCD can experience very high levels of anxiety and distress and find that it can take up a lot of their time. Examples of obsessions that may affect the pupil's learning in school include fears of contamination, things not being symmetrical, harm coming to themselves or others, and unwanted thoughts about doing something forbidden or embarrassing. There are many different types of compulsive behaviours that may be spotted in school. This includes repetitive touching or tapping, checking things many times over, arranging things so that they are just right, constantly counting, and an inability to handle common objects. Body dysmorphic disorder. Body dysmorphic disorder is an anxiety disorder that specifically relates to body image, which has a significant impact on the ability to carry on with one's day-to-day life. A person might be diagnosed with this disorder if they experience obsessive worries about one or more perceived flaws in their physical appearance. The flaw cannot be seen by others or appears very slight, and develop compulsive behaviours and routines, such as excessive use of mirrors or picking their skin. This is closely related to OCD. A pupil with this disorder might spend excessive amounts of time getting ready for school, repeatedly asked to go to school toilets to check and update their appearance, try to get out of participating in certain lessons, for example PE, dance, drama, etc., avoid school altogether, not wish to seek help, fearing the scrutiny of others, and present initially with other concerns such as anxiety, depression, substance misuse, self-harm, and eating disorders. Eating disorders. Eating disorders are serious mental illnesses. People with eating disorders use disordered eating behaviour, which can include limiting the amount of food eaten, eating very large quantities of food at once, and getting rid of food eaten through unhealthy means. There is often a lot of overlap between different eating disorders. It is important to recognise that eating disorders are not all about food, but also about feelings. The way the person treats food may make them feel more able to cope, or may make them feel in control, though they might not be aware of the purpose this behaviour is serving. Some eating disorders include the following. Pica is a feeding disorder in which someone eats non-food substances that have no nutritional value, such as paper, soap, paint, and chalk. Avoidant restrictive food intake disorder, ARFID, is a condition characterized by the person avoiding certain types of food, having restricted intake in terms of the overall amount eaten, or both. Anorexia is a serious illness where the individual severely limits how much they eat and drink. Binge eating disorder is when people have patterns of eating very large quantities of food over a very short period of time. And bulimia is a condition where binging episodes are compensated for by purges such as vomiting, taking laxatives, fasting, or over-exercising. Bipolar disorder. Bipolar disorder is a mental illness where one has extreme changes in mood and energy levels. These episodes can be short in duration, or they can last for months. Bipolar mood swings are much more extreme than most people's experiences of feeling happy or sad. People with bipolar go through extreme lows of deep depression and suicidal thoughts, mixed with extreme highs of intense excitement and happiness. The highs are called mania and hypermania. Bipolar disorder can affect anyone, but symptoms do not usually start before adolescence. Psychosis. People who are psychotic have episodes where they lose touch with reality. This includes hallucinations, seeing, feeling, smelling, or hearing things that are not real, and delusions and paranoia, believing things that are magical or fantastical, thinking there is someone following them, or that there is a conspiracy against them. During psychotic episodes, a person might feel confused because unusual experiences might feel very real and normal to them, and they may respond to this, for example, by talking to people who are not there. They might also sense that time is moving too fast or too slow. Psychosis is rare, and it's important to bear in mind that hearing voices in particular is common. We can hear voices for many different reasons, for example, when falling asleep and waking up, not getting enough sleep, when feeling very anxious, and following a traumatic event. This is the end of this video. You can view more videos on this channel in the About series, including other About SEMH videos.